So you have ever probably gone to the laboratory and the doctor orders for a full hemogram test, and the results come out and you're left with figures and numbers, wondering what this actually mean. So in this video we will actually be breaking it down to you one-on-one and telling you how you can actually interpret these results and these figures and numbers. So George here from George's Solution, a YouTube channel that helps you understand more of medical world, and also we speak of medical issues and laboratory techniques. So if you haven't hit that subscribe button, maybe you might consider doing that. So right away, let's go to the interpretation of full hemogram report. So full hemogram report is also sometimes called a CBC or just the hemogram report. Now CBC stands for a complete blood count, and it can also mean the full hemogram. It is one of the most commonly ordered tests in the laboratory, and definitely it is the most ordered test in the hematology laboratory. So how do we obtain the blood sample? So peripheral whole blood is obtained from the veins, and the test is done within 6 to 8 hours, and the test is also done at room temperature. So we use a purple top type of tube that we use to obtain the test for full hemogram. Here, as you can see, we have to know that your blood is composed of very many elements. We have the red blood cells, we have the white blood cells, we have the platelets. So all these are cellular components that come together to make up your blood. So when you're doing a full hemogram report, these parameters like the red blood cells, they have ranges. A normal person has to operate within a specific range. Misconspirancy in these ranges that actually helps us to diagnose whether your body is having a problem or not. And this is basically what is done in the full hemogram. So we measure the red blood cells, that is the total red blood cell count, the hematocrit, and definitely as the video progresses I'll be able to tell you what the hematocrit is. We measure the MCV, RDW, all these we will be able to discuss today. So we also do white blood cell data, and we also do the white blood cell differential count. So let us go right to total red blood cell count. So the total red blood cell count is the total number of circulating RBCs. RBCs therefore stands for red blood cells in 1 millimeter of peripheral blood. So red blood cells, they are used to transport oxygen throughout your body to different tissues, but these red blood cells, they are produced in the bone marrow. But in as much as they are produced in the bone marrow, their stimulation is done by a hormone called erythropoietin, and this erythropoietin is manufactured in the kidney. I hope we are together up to that point. There is a reference range. In male, the reference range for red blood cell is 4.2 to 5.8, and in female it is 3.8 to 5.2. So you can see that in male it is slightly higher, and in female it is slightly low. So red blood cells also have a lifespan of 120 days, and it is also higher in males and in newborns. The picture of how the red blood cells look. Hemoglobin concentration is a measure of the amount of hemoglobin in peripheral blood. So this reflects the number of red blood cells in the blood. So what is hemoglobin? Hemoglobin is basically 90% of what is contained in the red blood cell. 90% of what is contained in the red blood cell is what we refer to as hemoglobin. So an increase in hemoglobin concentration can sometimes be due to a condition that we call polycythemia vera, whereby your body constantly produces a lot of red blood cells. Then we also have secondary erythrocytosis, chronic hypoxia, such as in heart disease and when you are in high altitudes, and also malignancies. Malignancies basically means cancers. Different cancers in your body can lead to high production of RBCs. So the reference range also varies from male to female and also in children. So in male it is 13.0 to 17.5 grams per deciliter, while in female it is 11 to 15.5. A decrease in the concentration of hemoglobin is a condition that we generally refer to as anemia. So the very first thing that a full hemogram report will help us diagnose is whether you have anemia or not. So by just checking your hemoglobin content, we are able to know if you are anemic or not anemic. So the decrease in the red blood cells amount, it means that your hemoglobin will be low, since hemoglobin is what is contained inside the red blood cells, right? So a decrease in hemoglobin concentration leads to a condition which we call anemia. So what are some of the things that can lead to decrease in the body's production of RBCs? So the body decreases the production of RBCs. For example, in the situation whereby there is bone marrow failure, like I said before, that the bone marrow is what is responsible for the production of RBCs. So when the bone marrow fails, it therefore means that there will be no production of RBCs. Also, sometimes there are nutritional deficiencies. For example, your body, for it to produce RBCs, it requires iron, it requires folate, it requires vitamin B12. So when you deny your body these essential nutrients, your body will have difficulties in producing these RBCs, and this can lead to anemia, and this is usually very common in children at a lower age. Okay, another thing that can lead to anemia is whereby the body decides to increase the destruction of RBCs. Yes, the body is producing the RBCs in sufficient amount, but now the rate of destruction of RBCs may be due to some drug you are taking, or just hemolysis, or just autoimmune disorders. The body decides to destruct or destroy the RBCs in a high amount. This can also lead to anemia. Another thing that can lead to anemia is loss of RBCs. For example, you have bled so much so that your body has lost a substantial amount of blood. For example, during accidents, road traffic accidents, there is high loss of blood. This can lead to anemia. So the next component of RBC that I want us to speak about is called the hematocrit. So what is hematocrit? Hematocrit is actually a measure of the percentage of the total blood volume that is made up of red blood cells. I hope we are clear. So we take the entire blood, whole blood, all of it that we have measured, and we want to see how much of it, what is the ratio of RBC to the total volume of whole blood. So this can be determined by centrifugation. Actually, centrifugation is the just rotation. We take the blood, we put it in a tube like this, and we rotate. We have a machine called a centrifuge. So the machine rotates the blood, and you find that the RBCs, since they are higher in density, they will separate downwards, and the other component of whole blood that is called the plasma will be suspended on the top of it. So we want to see the ratio of how much whole blood red blood cells have separated to the downer compartment, and how much supernatant the upper compartment we have. So this is what we refer to as the hematocrit. There is a rule called the rule of 3, whereby when you take the hemoglobin times 3, you will get the hematocrit. And of course this is subjected to plus or minus 3. And also when you take the red blood cells and you multiply by 3, you will get the hemoglobin, and this is also subjected to plus or minus 3. The reference range of hematocrit in male, it is 38 to 54, and in female it is 34 to 46.5 CHC. So when you are presented with a hemogram report, you'll see something called MCHC. So the MCHC is called the mean cell hemoglobin concentration of RBC. So we are still speaking of hemoglobin. So we want to know, we want to see the average amount of hemoglobin contained in an RBC. The reference range, of course, it is 32 to 36 grams per deciliter. So when the MCHC is normal, we refer to that condition as normochromic. The MCHC is low, we refer to that condition as hypochromic. That is when MCHC is low. So you can actually have a type of anemia called hypochromic anemia. What does this mean? It means it is an anemia that is associated with low MCHC. And also when MCHC is high, maybe you can guess that if we have normal and we have hypo, when it is high it will be, yes, hyperchromic. So hyperchromic condition or hypochromasia is a condition whereby the MCHC is higher than the required amount, which is 32 to 36 grams per deciliter. And of course, there is a formula for calculating the MCHC. MCHC can be calculated by hemoglobin times 100 all over the hematocrit. So when we take the hemoglobin and we multiply it by 100, then the figure that we get, we divide it by the hematocrit, we will get the figure for MCHC. So there's also another compartment of RBCs that we refer to as MCH. This is now not MCHC, but it is MCH. We have left the C at the end. So the MCH is generally the amount of hemoglobin within the RBC. So we just generally want to know how much hemoglobin is in an RBC. So it greatly correlates with the MCV. Of course, after this, I'll tell you what the MCV is. So the smaller the cell, the lesser the hemoglobin, and when the lesser the hemoglobin, the lesser the MCH. I hope you got that. When the cell is small, it means that it will not be able to accommodate a large amount of hemoglobin because it is small. So when the hemoglobin is small, this will also translate to a smaller MCH. So the reference range is 28 to 34 picograms. Actually, picograms is a trillionth of a gram. That is also a unit. Picogram is a trillionth of a gram. So the MCH is calculated by hemoglobin times 10 all over the RBC. So we take the hemoglobin, we multiply it by 10, and we divide the figure that we get with the RBC. So when I was doing the MCH, I mentioned the MCV, and I told you the MCH correlates with the MCV. So what is the MCV? So the MCV is a measure of the average amount, or generally just the size of an RBC. That is what we call MCV. MCV in full is mean corpuscular volume. Mean corpuscular volume, that is the MCV in full. So you see there is a volume there. So it is a measure of the average volume or the size of an RBC. MCV is also an important aspect that we use in characterizing the types of anemias. For example, normal MCV is, we call it normocytic anemia. In a situation where you have anemia but your MCV is presenting as normal, we will say it is normocytic anemia. Reference range is from 80 to 100. Decreased or a small MCV, we will call it microcytic anemia. So when it is decreased, it is microcytic. When it is increased, we will call it macrocytic anemia. So by the way, you can have some types of anemia in relation to MCV and MCHC. By normochromic was normal MCH, hypochromic was low MCH, and hyperchromic was high MCH. So in a situation whereby we want to correlate the MCV to the MCHC, we can have normocytic normochromic anemia. What is that? Normocytic meaning that the MCV is normal, and it is also normochromic, meaning that the MCHC is also normal. But we can also have another phenomenon presenting like microcytic normochromic, or microcytic hyperchromic, or microcytic hypochromic, or macrocytic, whereby it is now large MCV, but as much as it is macrocytic, it is normochromic. So microcytic means that the MCV is increased, but the MCHC is normal, macrocytic normochromic. This can also tell us how the red blood cells look, by the way, because in a situation whereby there is anemia, whereby it is macrocytic, the average volume is high, macrocytic, but it is normochromic. It means that the size, the cell has a normal size, but now the volume is large, containing nothing. I don't know if you're getting me. For example, the red blood cell should be having hemoglobin in it. So in a situation whereby it is macrocytic normochromic, it means that the red blood cell has a good size, the average size that it required, but now the content there is nothing. There's just a bioconcave shape and a small dot at the center with nothing contained in it. So in that situation, we'll be call it macrocytic anemia. So you can see that these compartments from full hemogram like MCV can help us actually to know the type of anemia and know the cell morphology. We can even have a picture of how the cell looks like by just looking at these figures. So the next thing I want us to look at is the red blood cell distribution width. So the RDW, it is a measure of the variation of the different sizes of RBCs. So you get that there are some individuals that present with different sizes of RBCs, such as some are large, some are small, some are normal. So in that situation, what will help us to categorize this is the RDW, that stands for red blood cell distribution width, and its normal range is from 10 to 15. And by the way, a condition in which there are variation in the sizes of RBCs, we refer to this condition as anisocytosis. I hope you got that. Anisocytosis is the condition whereby there is variation in the size of RBCs. Actually, it is derived from the red blood cell histogram, red blood cell histogram, and generally, an elevated RDW has also been associated with different types of anemias, such as those anemias that occur due to iron deficiency, vitamin B12 deficiency, or folate deficiency. These are the nutrients that are used by the bone marrow to manufacture RBC. So thalassemia actually is an anemia with it is a microcytic anemia that it has a normal RDW. So right now we want to do something on white blood cells. So a decrease in the number of white blood cell is called leukopenia, while an increase is called leukocytosis. So when there is a low number of WBCs, we will say that is leukopenia. When it is increased, we will say that it is leukocytosis. So the reference range is 3.5 to 10. WBCs, or white blood cells, or leukocytes, they are majorly used in defense. They are used by the immune system to defend our body against diseases, and this is the bottom line of what we'll be discussing about WBCs. It therefore means that when either the WBCs are higher or they are lower, it can tell us whether your immunity is trying to fight a specific disease. So that is why these reference ranges are important. We have different types of full hemogram machines, by the way. We have the 3-part and the 5-part. The one producing a light behind me, that is a 3-part full hemogram machine. And we also have the 5-part. And the difference between 3-part and 5-part full hemogram machines is that the 5-part machine is actually able to break down to you the different types of WBCs. That is, it can tell you this is the number of eosinophils, this is the number of basophils, this is the number of neutrophils, this is the number of monocytes, this is the number of lymphocytes. It is able to break down to you the different types of. So let us go to neutrophils. So when there is an increase in number of neutrophils in your system, we say that this is a condition that is called neutrophilia. So what are some of the conditions that can lead to neutrophilia, whereby your body has a high amount of neutrophils? This can be due to bacterial infection. You can also query tissue destruction, such as when you are burnt. Inflammation, cigarette smoking can also lead to neutrophilia. Corticosteroids can lead to neutrophilia, and B agonist can also lead to neutrophilia, and of course leukemia, type of blood cancer that leads to the production of numerous WBCs, can lead to neutrophilia. So that is a picture of how neutrophils look like, as you can see. There is also a condition called neutropenia. So neutropenia actually is the opposite of neutrophilia, whereby in neutropenia it is now a decrease in the number of neutrophils. So this can be due to decrease in the bone marrow production. So the bone marrow just decides not to produce neutrophils. So this can lead to neutropenia. Some medications such as cephalosporins and also neutropenia can be due to immune-related phenomena and post-acute infections such as in viral infection like HIV, cytomegaloviruses. All these viruses can lead to neutropenia. The next type of WBC is the eosinophil. Eosinophilia is an increased eosinophil count, and this can be common maybe in parasitic infections and during allergies. Maybe you have an allergic condition or a hypersensitivity reaction. Aspergillosis things can lead to eosinophilia, and eosinopenia is a condition whereby there is a decrease in the number of eosinophils, and this can be majorly common in a situation whereby there is sepsis. So that is a picture of a eosinophil. As you can see, that's how a eosinophil looks like. The next type of WBC that we'll look at is called the lymphocyte. And lymphocytosis is an increase in the number of lymphocyte count, and this is common in viral infections such as HIV and cytomegaloviruses, HPV. All these viruses can lead to lymphocytosis. Also leukemia, like chronic lymphoid leukemia, which is called the CLL, and when you have a lymphoma also can lead to lymphocytosis. Lymphopenia is a decrease in the number of lymphocyte count, and this is also common in viral infection, medications, or autoimmune disorders. Autoimmune disorders is whereby your body decides to fight itself. It produces maybe substances that kill these lymphocytes. It fights itself. Then we have monocytes as another type of WBCs. Actually, monocytosis is an increase in the number of monocytes in your system, and this is common in pregnancy, tuberculosis, and syphilis. So you can see that actually the full hemogram report can tell us a lot. It can tell us so much. We can even now, for example, when you have monocytosis, we now start querying pregnancy, we can query TB, we can query maybe syphilis, and therefore you will be sent maybe for a test on VDRL. So the full hemogram report can help us query a lot of things, and it actually breaks down to us just by looking at those figures, those ranges. So when you have a higher range, we query something. When you have a lower range, we also query something. And monocytopenia is a decrease in the number of monocyte in your system, and it is common in acute infection, in steroids, and also in leukemia. That is a picture of a monocyte, as you can see. So the last component that we want to speak of is platelets. So platelets or thrombocytes, platelets are also called thrombocytes. Their principal function is to prevent bleeding, and their reference range actually is from 150 to 4,000. The number of platelets, when it is increased, we call it thrombocytosis, and this may be due to splenectomy, inflammation, or myeloproliferative diseases, or IDA. IDA is iron deficiency anemia. This can lead to increased number of platelets. So a decrease in the number of platelets is called thrombocytopenia, and this can be due to blood loss, splenomegaly. Medications such as antibiotics can reduce the number of platelets, viral infection, bone marrow disorders such as in leukemia. And by the way, another thing I wanted to tell you is that when you check the number of platelets and you find that it is generally very low, you should also query maybe a parasitic infection and mainly malaria parasites. So maybe you can consider doing a malaria parasite when you see that the platelet count is so low, because platelets have a role in curbing an RBC of 3.49, whereby the reference range is 3.60 to 5.50. So it means it is low. 3.49 is low, so maybe we'll query anemia, and by going down we will maybe be able to query the type of anemia. Hemoglobin of 10.4, whereby the reference range is 12 to 16 grams per deciliter. So 10.4 is low because the reference range is from 12. So we will still query anemia. A hematocrit of 31.2. So here we'll still query anemia since we are still dealing with RBC, and an MCV of 82. Yet the reference range is 85 to 95. So when the MCV is low, we said that is microcytic. When the MCV is low, we said that is microcytic anemia. So in this situation, the type of anemia that we can query here is microcytic anemia, and the MCH of 28.3 to and the reference range is 28 to 32. So here the MCH is normal picograms. The MCH is normal, and an MCHC of 33.3, and the reference range is 32 to 36. So in such a situation, the MCHC is also normal. So maybe here we will call it normochromic, since the MCHC is normal. So we'll call it normochromic. Red blood cell distribution width of 6.6, and the reference range is from 11 to 15.0%. So in such a situation, malaria infection, for example, us who are along the tropics and along the lake, there are increased number of mosquitoes around the lake region, Lake Victoria region. So when there is an increased number of mosquitoes, it therefore means that the prevalence of malaria infection will be higher. So at the end of every full hemogram report, there are always some cell histograms. These cell histograms are actually some graphs that show the cell size and the cell number. They just show the cell size and the cell numbers. Let us speak of manual differentials. So when we are speaking of WBCs, manual WBC differentials are performed by trained medical technologists, and they count and categorize typically 100 white blood cells by microscopic examinations, and they use Romanowski stained peripheral blood smears. In addition to differential counts, evaluation of the smear provides the opportunity to be able to morphologically evaluate all components of the peripheral blood smear, including red blood cells, white blood cells, and platelets. So the manual differential allows for the detection of disorders that may otherwise be lost in an automated system. So when we are using the automated machines, it is not able to tell us that, hey, there are malaria parasites in this blood sample, because it will only count the blood components. But when we are using manual differentials like the PBF, peripheral blood smear, we are able to see abnormalities and disorders such as maybe infections in the blood, like in case of parasitemia. So there is this CBC here, and I'd like us to interpret it, whereby the WBC is 19.5. So when the WBC is 19.5 and the reference range is 4 to 10, what will we query in such a situation? So here we will maybe query a bacterial infection, and since this is the general WBC figure, since this is not the differential WBC count, we will query a lot of things like bacterial infection, viral infection, parasitic infection, maybe there is a burn somewhere. So the next component, an RBC of 3.49, whereby the reference range is 3.60 to 5.50. So it means it is low. 3.49 is low, so maybe we'll query anemia, and by going down we will maybe be able to query the type of anemia. Hemoglobin of 10.4, whereby the reference range is 12 to 16 grams per deciliter. So 10.4 is low because the reference range is from 12. So we will still query anemia. A hematocrit of 31.2. So here we'll still query anemia since we are still dealing with RBC, and an MCV of 82. Yet the reference range is 85 to 95. So when the MCV is low, we said that is microcytic. When the MCV is low, we said that is microcytic anemia. So in this situation, the type of anemia that we can query here is microcytic anemia. And the MCH of 28.3 to and the reference range is 28 to 32. So here the MCH is normal picograms. The MCH is normal, and an MCHC of 33.3, and the reference range is 32 to 36. So in such a situation, the MCHC is also normal. So maybe here we will call it normochromic, since the MCHC is normal, so we'll call it normochromic. Red blood cell distribution width of 6.6, and the reference range is from 11 to 15.0. That one we will say it is anisocytosis. And platelet count of 98, that is so low, we will say that maybe this one has coagulation problems. That's the end of our presentation. If there is any question or any other topic you may want me to tackle, please let me know in the comment section, and don't forget to subscribe and click the notification button for you to be able to receive more content as we update. Thank you for staying with me. That was George's Solutions. Bye.